Good evening, everyone. Today's session is going to be really helpful, and it's led by Dr. Malathi from Apollo Cradle and Children's Hospital. She's going to talk about safe asanas during pregnancies. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
So I'm Dr. Malati Lata. I'm a prenatal and postnatal yoga instructor and a physiotherapist and lactation counselor, Apollo Cradle Koramangala. So today, as she said, the topic is about safe asanas during pregnancy. So here, first you need to know what is the pregnancy, like how it is divided. The pregnancy is divided into trimesters, that is first trimester, second trimester, and third trimester. The first trimester is generally from week 1 to the end of week 12. So that is first trimester. And the second trimester is from 13th week to the end of 26th week. And the third trimester is from 27th week to the end of the pregnancy, or we can even consider it as 40 weeks. That is because the pregnancy, duration is about 40 weeks. So generally, we advise exercises from the second trimester properly. That is in the first trimester, because mostly the conceived mother will be having nausea, vomiting, and also because the baby's organs are forming, we never advised any twisting movements or anything like jumping activities or any high intensity exercises. So generally in the first trimester, we just advise only mild exercises like breathing exercises, or it can be general like mild, like not very fast walking to an average. And next, maybe like some breathing exercises that which can help them to reduce the stress, and all these things can be done in the first trimester. And from second trimester, yes, the mother has to start with a proper routine, that she can follow only with the doctor's advice, that is with a concerned gynecologist advice. So we'll see what is prenatal yoga first, because otherwise, like means what in what way it is going to help, or like what is this prenatal yoga. It's like, as you know, it's like yoga is something a traditional practice. It's not like new thing. It's a traditional practice that combines any specific asanas or pranayamas, relaxation techniques. So that is which going to help the mother to balance, and also to get the self awareness and physical strength and mental health. And as I told you, it is a low impact fitness. It's not that high intensity exercise. Yoga is never a high intensity exercises. That too, especially during the pregnancy, we follow only low impact or low intensity exercises, which will definitely help the mother to gain the strength and flexibility of the body. And also this routine, like a regular routine of following the asanas during the pregnancy, will definitely reduce the stress levels, and also they will get better sleep. Prenatal yoga also definitely will include deep breathing exercises and like some suitable postures, because sometimes the pregnant mothers may have some discomforts like back pain, or sometimes they may have severe swelling in their legs, or sometimes they may have some problems like in the wrist, like wrist pain, or some carpal tunnel syndrome or something. So which there are some postures that can help during the pregnancy, throughout the pregnancy period for the pregnant mother. And also some gentle stretching exercises on the meditation, and which will make them the like emotionally strong, and they'll be physically fit. They can stay physically fit during the pregnancy time. So these are like some benefits, like particular benefits, that is especially going to help the pregnant mother. So that is to promote a healthier pregnancy. And also when they are doing some exercises, this improves the blood supply to the mother as well as to the baby. So indirectly they are going to get, the baby is going to get nice nourishment to the baby, and which helps to tone the physical body, that is pelvic floor and the hip as well as the abdominal muscles. Okay. And prepares the body for labor as well as for the delivery. And also this, as I told you, just like it is going to definitely help to ease the pregnancy discomfort, creates healthy bonding between the mother and the baby, and improves the posture and helps to recover faster after the delivery. So these are the benefits, general benefits of the prenatal mother. And what precautions the mother needs to take. That is, during the pregnancy, we advise avoid overstretching, which I told you already. Avoid overstretching, twisting, and poses that puts pressure on the abdomen. And it is also like crucial to stay hydrated. So you need to drink water, sufficient water, and also you need to practice only with the certified prenatal instructor. Okay, clear? It is always better to practice with a guidance, with the guidance of a certified prenatal yoga instructor. And when you are doing the asanas, you should always ensure you are a little relaxed and you're comfortable. And because there are many asanas, sometimes you'll not be able to completely do it. So in that cases, we advise to use some props. That is, you can use pillows or bolsters, or like maybe some other, like maybe the, like you can use like any cloth or something to support or to balance your postures. So in that case, that helps to maintain or to focus on maintaining a proper alignment, especially for the safety and as well as for the comfortness. So, and next, like you can start generally now, like even the first trimester also. So they can start with breathing exercise. Breathing exercise is very safe even in the first trimester or second trimester or third trimester. So especially we advise this deep breathing exercise. So that way, there are many names for that. You need to like practice this deep breathing exercise to reduce the stress, and also this improves the oxygen supply to the mother and the baby. And definitely this deep breathing exercise will help to relax the whole body. So we say it as a cleansing breath, or there are many names for that cleansing breath, deep breathing exercise, or the relaxed diaphragmatic breathing exercise. So you can do in a silent way, like in a silent room, so where you're not getting distracted when you're doing this breathing exercise. So that is, you can take one hand on your chest and you can take one hand on your tummy. You can take a deep breath through your nose like this, and then you need to blow out. Oof, like this, as if you're blowing a balloon, or like as if you're blowing a candle. It's like you need to be little slow in exhaling. That is, slowly you need to exhale through the mouth like this will help to relax the mind. So maybe you can practice this regularly, twice also, according to your convenience. And next is, we say it as a Brahmari Pranayama. This is also an excellent exercise during your pregnancy, and this also helps to reduce the stress levels, and also helps to relax your mind, and improves definitely your sleep pattern, and release some congestion. If you have any congestion in your chest, that will also will get released by this practicing, regular practice of this Brahmari Pranayama. So you can place all your fingers like this, and you need to take a deep breath through your nose and exhale like So this is otherwise called breathing or B breathing. This is also an excellent exercise during your during the pregnancy to relax the mind. And next is some asanas. There are some asanas which you can very well go ahead, like, because they're safe asanas. Some because it depends upon the mother's condition, because they may have some other problems like high BP, or like maybe some other problems like swelling in the legs, or like maybe some other complications. So in that case, not everyone is advised to do all the asanas, but there are very safe asanas that you can practice whatever it is. So those are like Parvatasana. So then those things, those list, this asanas comes, that is Parvatasana. This actually a very good safe exercise which helps to stretch the abdomen and the pelvic muscles, and it helps to lose the hip joints, because sometimes you may feel tightness in your lower especially in your hip joint, or sometimes in the back. So these Parvatasana, like there are various modifications, that is taking the hands up like this straight, and then turning to side to side. So there are modifications to do this Parvatasana. So you can do those things also if you are little comfortable. That's what it's like. You just have to ask your yoga instructor, and with his advice or her advice, you can just follow this Parvatasana, because it even improves your concentration and focus. And the next is Janu Sirsasana. So this is again very good to strengthen the spine, as well as even stretches the spine as the stomach muscles. It even helps for digestion. Mostly in the first trimester, sometimes you may have digestion problems, or even in the second trimester, very rarely, yes, you may have some digestion problems like constipation, or sometimes because if you are taking some iron tablets, you may have some like loose motions also. So this practice of this Janu Sirsasana will help you definitely to improve your digestion. And it's like even it is effective in lowering the intensity of the IBS, especially this IBS, that is irritable bowel syndrome symptoms like pain, fatigue, and distress, especially. And also it improves the sleep quality and helps even for gastric problems also. And next is the Chakki Chalanasana. That is, this is again a very good exercise, hip opening exercise, which is really helpful during the pregnancy period, and especially in case if you have the sciatic type of pain, that is which comes in the lower back, and which radiates to both the sides or one side of the leg. So this this asana will definitely help to release the symptoms, and also it helps to tone the abdominal as well as back, abdominal as well as back, and even the strengthens the arm, because you will be doing like your moving your arms like this. It's like you just have to do circles like this. So this is going to even tone the arms also, and even stretches the upper and the lower back. And it's a very good exercise to strengthen the uterus, especially uterus, and also helps for even sleep disorders. And next is the Upavista Konasana. This is again a very good hip opening exercise, which helps to improve your muscle strength, and also it helps to, especially for the lungs. That is, in case if you have difficulty in breathing, or sometimes like if you are not taking deep breath, okay, so shallow breathing, or sometimes in the case if you have any anxiety issues and all, it's like you can easily do this practice, this Upavista Konasana, which helps to release all these problems. Especially good, it's a good exercise to release the tension and boost confidence, and improves your mental well-being. And next is the Tadasana. This is again a very good, excellent exercise to stretch the whole body. That is, you can take your hands up, and you need to inhale and take your hands up and raise your heel also. That is Tadasana. Maybe you can either do it in standing, or if you're not comfortable in standing, in a sitting in a chair also you can do. That is taking the hands up like this. Inhale, and you need to take the hands up, stretch, and exhale and relax. So this is again according to the variations, like you can according to your comfortness, either you can sit and do it, or standing also will do. This definitely will improve your posture and coordination during your pregnancy, and even this relieves back pain, that is the sciatic pain. And it also helps to improve your blood circulation, and it tones the core muscles definitely, and strengthens the back and the hip muscles. And next is the pelvic rotation. And this helps to release the sciatic type of pain, that is the low back pain, and it stretches these strengthens and the abdominal muscles. It prepares the pelvic floor muscles for delivery. So there are some asanas which helps the pelvic floor muscles for delivery. So in that category, this pelvic rotation really helps. And this also enhances the breathing and the blood flow. And along with you, when you do this pelvic rotation, definitely the baby is also going to enjoy. So if possible, at least maybe 1 minute or like 2 minutes that you can do regularly. And if you're not able to stand and do, you can take some back support, or you can even take wall support, and you can just slightly bend forward, and then you can do this pelvic rotation. So these are like some modifications as like you can take during the pregnancy, because we cannot particularly go for a particular posture like in a regular way. So you need to have some modifications during your pregnancy according to your comfortness. And so these asanas, whatever that I mentioned, are very safe exercises during your pregnancy. So along with this, we advise even to practice meditation. That is again excellent practice during the pregnancy. So along with meditation, if you can practice some mudras, that will definitely help, because there are some mudras that you can especially like prana mudra, like, and then which there are some as mudras to improve your BP. So there, like, you can practice those asanas regularly for maybe 5 minutes in the initial stage. Then you can even improve up to 15 minutes regularly. It's like you will not be able to do more than that, like for 1 hour, but at least start with minimum 5 minutes, because this meditation will definitely will bring some calm, and like you'll feel that you are calm, and that especially which helps for meditation will help for anxiety issues, and if there is any BP issues, that also can be regulated by doing this meditation. And definitely this is meditation is going to help overall, that is emotional well-being, and then as well as overall health. It's going to improve. And I hope I'm done with the presentation. So thank you.
No questions, doctor.
Thank you. Thank you.
End stream.